Introduction to fascia for sports massage. Fascia is often seen as a buzzword or topic in the world of sports massage and bodywork therapies. It's fairly new, as it was only really discovered within the last century, so research is often changing all of the time. But it's important for us to understand what fascia is because it covers every single part of our body. So as a massage therapist, by placing your hands on your client's skin, you will potentially have an indirect effect on your client's fascia. This presentation is an introduction to fascia. We do relate some of it to science and discuss some of the more recent science and current research that is out there. But if it's something that you're really interested in, I would suggest you go into some further learning and research. And we've got some really good references at the end of this presentation. What we will cover, we're going to look at what fascia is globally within the whole body, but also on a cellular level. We're going to discuss the different types of fascia and the names for fascia in different parts of the body. We're going to look really closely at the cellular makeup of fascia, how fascia links with the sensory nerves and the nervous system. And then we're going to go back to global and look at fascia and the whole body and why that's important for us to understand that when we're working with our clients in sports massage. So, what is fascia? Fascia is a three-dimensional web that embodies cells, nerves, and it is the immediate environment of all of our 37 trillion cells. So it covers every single part of our body. It's innervated by nerves and contains 100 million sensory receptors. So it's very sensory rich. It gets lots of feedback from our senses, which then feeds back to the central nervous system, to our brain. It's often divided into sections and subsections, depending on the area of the body that we're discussing. And what's really interesting, as the terminology for fascia is often interchangeable, as it's fairly new within research and anatomy, a lot of the research that is out there use variable terms, but discussing the same area of fascia. So, it's often divided into four main sections. We have the superficial fascia, the deep fascia, the meningeal fascia, and the visceral fascia. So let's explore each one. So the superficial layer of fascia is the layer of fascia that's directly underneath the adipose tissue, so directly underneath the fatty tissue and the skin. It separates the skin from the muscles and allows that slide and glide to occur from the tissues. But it's also involved in functions such as thermoregulation, circulation, and for the lymphatic system to flow throughout the body. The next is the deep fascia. Now, this is a real dense, fibrous layer of fascia. It's considered like a body stocking or a catsuit. And if you've seen some of those anatomy images of fascia and about that huge body stocking, that's what they're referring to. It encompasses each muscle and it separates but also connects everything together. It's also the layer that force transmission takes place within the fascial system. So it allows us to move and it transmits force from one part of the body to another part of the body. And it can really affect neighboring muscles or even completely different areas of the body. That's why sometimes you might feel a stretch in one area and then you'll feel that through into a completely different part of the body. And it's this layer of fascia that we think of when we're looking at maps such as the anatomy train's myofascial lines. The next is meningeal fascia. Now this one is the fascia that surrounds the nervous system and the brain. And then lastly, the visceral fascia, and that one surrounds the organs of the body. Now fascia is both elastic and plastic, so it's made up of fibers, but it also has a fluid property to it. So it's known as a colloid substance. If you think of like a rubber band and how it pings back to normal after it's been stretched out, but it also can deform over a long period of stretching over time. And we'll discuss that later on in the course. Another word that is often used when talking about fascia is the myofascia or myofascial system. Myo means muscle and fascia is fascia, and it comprises of the connective tissue of the superficial fascia and the muscular system together. This image here is a really good one from Van Hagen's Body World, and it questions whether there are 600 muscles or one muscle in 600 fascial pockets. And this also comes from anatomy trains, which we're going to discuss anatomy trains and the myofascial system later on in the presentation. So let's look at what fascia is made of. So fascia is made up of two different components. The first one is extracellular matrix, or ECM, which is made up of ground substance and fibers such as collagen and elastin, and then also cells. And cells is made up of mostly fibroblasts, other cells such as tellocytes, and then nerves and vessels. The extracellular matrix. So this is a substance that's within the fascia. It's the colloid substance where it's both fluid and fibrous. And it's made up of the collagen, elastin, and that ground substance combined, which creates that colloid style substance. Ground substance. So ground substance is a fluid part of the extracellular matrix, and it's where the chemical exchanges take place. As Johan described in his book, it is the immediate environment of every cell in your body. It fills all the spaces between the fibers and the cells and contains around 15 litres of water. This fluid is interstitial fluid, and it's responsible for the transportation of nutrients and has roles in such as remodeling of tissue, inflammation, and also lymphedema. And it's also really vital to maintain healthy tissues and homeostasis within the cells. And the connection between the extracellular matrix, the ground substance, and the cells is a cell receptor called integrin, which permeates the cell from the extracellular matrix, which we'll discuss in a few slides' time. So elastin and reticulin. Now these are two of the fibers that you find within the extracellular matrix alongside collagen. So elastin does what it sounds like. It's the elastic fiber within fascia that it gives it that resiliency. And it's elastic so it can stretch quite far, up to 230% of its original length. So reticulum is formed by the type 3 collagen, and it's mostly part of the collagen that's formed within organs. It's not found in every type of fascia. Collagen. Collagen is the most abundant protein in the body, and there are at least 15 different types of collagen that have been recorded. However, the Kumkara Bonar study suggests there are at least 25 different types of collagen, so the research is still inconclusive. Type 1 collagen is the most abundant in the body, around 90%, and it's found within the skin, the bone, tendons, ligaments, and within the fascia. But fascia itself can contain an array of different collagen types, according to the Kumkara Bonar study, suggesting that it's not limited to types between 1 and 24. The shape of collagen is a triple helix shape, which gives it its tensile strength, and gram for gram it's been suggested that collagen is stronger than steel. So it's a really strong fibre within the body. And it's also thought to respond to Wolff's law. So Wolff's law is the bone's ability to adapt when regular loads are placed on it, becoming stronger. So mechanical stress, mechanical force over time increases the osteoblast activity, strengthening bones and increasing bone density. And it's been thought that collagen has a similar response like Wolff's law. And as you can see here, there are three different images of collagen. So the first images A and B. So A is a normal soleus muscle and B is a normal gastrocnemius muscle. So the collagen fibers within these tissues. And then it shows C just below, which is the collagen fibers of a soleus muscle that has been immobilized. So going back to the Wolff's law and how we think collagen may respond to Wolff's law, over time with immobilization, so lack of movement, collagen forms in a less linear pattern and more wiry pattern. Fibroblasts. These are the most abundant cells within fascia. And what they do is they produce and maintain the extracellular matrix, but they're really responsible for the synthesization and the remodeling of collagen depending on where the tension is. So going back to the integrin and the pull of the cell, those are responsible for creating and remodeling collagen depending on where tension is and mechanical stress is. So scientists used to think that the collagen formation from fibroblasts was more linear, but some research from Grinnell in 2007 and Jumbarto in 2007 found that they form more of an organized 3D matrix, so it's a little bit more disorganized. Fibroblasts also have the ability to morph into myofibroblasts, which help with wound closure at the cellular level. So the myofibroblasts are part of the inflammatory response and wound healing. Fibroblasts are also responsible for the tissue homeostasis, going back to adapting through mechanical force and synthesizing collagen and remodeling collagen where tension is. They interact with the collagen fibrils, which then transmits force in a certain direction to maintain tension or balance. So I'll keep remodeling collagen to maintain tension or balance wherever that force needs to happen. What they do need is a stimulation to produce the collagen. And Grinnell in 2007 found that when there is low tension and low stimulation, collagen production reduces. And when there is high tension and more stimulation, collagen production increases. So going back to that image of the 3 different types of collagen from the gastric and the soleus, and then looking at the soleus tissue of an immobilized tissue, you can see there's low stimulation, so there's less collagen being produced than when muscles and tissues are more active. So what fibroblasts do is they synthesize collagen where there is more pull and then secrete collagenase, which is the enzyme that mops up collagen where there's less pull. And it's all based on vibration and information based on the mechanical stress and tension. And then lastly, another part of the cell makeup is the telocytes. And some research in 2006 by Cratio found that there is another cell within fascia known as a telocyte. And these telocytes, so these cells, are mechanosensitive cells, and they're vital for many physiological processes such as tissue repair and immune function. And these are also communicators and can share information and genetic material to other cells. But the research is still quite new on these telocytes, but it is a big focus in current research within fascia today. So this image is from Giamparto, and it's from the video Strolling Under the Skin, and there is a video in the online learning of that, a YouTube link of that video, and I recommend giving it a watch. So this just shows how one fascia is completely disorganized, so you can see here that disorganized web, but what it does do is it doesn't stretch or come away when there is that sliding guide. So from muscles and bones move away from each other, muscles and tissues move away from each other, then that fascia organization is still disorganized, but is still intact. It doesn't lose any connection. Just recapping this quote from Grunwald from his research. Fascia is innervated by nerves and contains 100 million sensory receptors, which is huge and lots more than they initially thought with some of the earlier research within fascia. When we look at the peripheral nervous system, so where these sensory receptors live within the superficial fascia, they gather information which then sends that back to the central nervous system to the brain, which then creates a response via the motor neurons. Within our tissues, there are 3 times as many sensory nerves as there is motor neurons. So our bodies like to be sensory rich. So as a massage therapist, when we apply touch to the skin, we are innovating and we're reacting and activating those sensory receptors. So if we think about sports massage and hands-on therapies, what we're trying to do is calm down the body and upregulate that parasympathetic nervous system, which we do with touch, which then affects the sensory nerves. So if we are affecting the sensory nerves, we're calming the body down, there may be a change to fascia and what's happening within fascial tissue. So let's take a look at fascia anatomy and the bigger picture, which is the most important thing when we're looking at how our clients are moving and working with our clients. It all begins with the word tensegrity. Tensegrity was a term coined by the architect Buckminster Fuller in the 1960s, and what he found and explored with one of his students was the relationship between sturdy, stable structures such as beams and more tensile structures such as cables when it came to looking at floating structures such as bridges. And what they found was that the structure's integrity was maintained primarily due to the balance of those tensile forces. So the cables maintained tension, keeping the structure in the place that it needed to be created by. This was then brought into anatomy originally by an orthopedic surgeon called Dr. Stephen Levin, who was looking at a dinosaur that had a really long head and neck and really short legs. And what he found when he was looking at this dinosaur was that his current thinking and learning on anatomy didn't make sense when you're looking at a structure that has a really long floating head and really long floating neck, and started to explore how this then fit in with anatomy. So then tensegrity moved into the anatomy and physiology world, and the word biotensegrity was created. And it looks at the relationship between the sturdy, strong, stable structures of bones and the more adaptable, buoyant structures of the ligaments and the myofascial system in whole. And we're looking at this by creating an extra tension or a different type of tension through one part of the body by affecting the myofascial system, or in the structures cases, in the moving bands, then the structure itself, so the stable structure, will then move to adapt into that new position. So as an example, looking at the double tension pelvis image, if we were to pull on one of the lower struts of the pelvis that leading towards the legs, then that whole structure will be affected, which is what we think happens within our body. So just as an example, while you're sitting here and watching this presentation, put both feet onto the ground, and I want you to push down with your left foot as hard as you feel you can, and just notice what happens within the body. So as you're pushing down, do you notice activation in the quads, in the glutes? What's happening to your shoulders and your spine in relationship to adapting to what's happening within the foot? And that's what happens within the whole body. So when we apply tension in one area and create that force, then that force production then affects the whole body. And this image comes from a video from Boneman Pro, which is a YouTube channel, which I've also included into the additional learning videos. So as you can see here, you've got the skeleton structure, and then you have the little tiny elastic rods that are connecting everything together. So if we just have a look at the neck as an example, you have one that connects from the scapula, then right the way through into the cervical spine, so coming from spine of scapula up, so that's, say, the levator scapular muscle or the fascial tissues around that. We have one that connects a little bit further down on the spine of scapula towards the upper thoracic lower cervical, so maybe around the rhomboids. And if we look down a little bit further, we have ones that connect from the iliac crest to the ribs, so looking at quadratus lumborum as an example. So you can see those more movable structures, the adaptable structures of the muscles can then affect into the bones. But it's best to watch the video to really understand how that works. So check out the video, which is on the additional learning page a little bit lower down than this video. And following on from that, we can then start looking at anatomy trains. Anatomy Trains was a model based on Anatomy Connection created by Thomas Myers. And he was a structural integrator and rolfer, and looked at the body based on the different lines of force production and muscle fibers. Did lots of dissections and looked at this anatomy connection as myofascial maps within the body, which takes on the principles of the Biotensegrity. So looking at the stable structure of the bones and the relationship between the myofascial system. He created 13 different lines in total, and they all conform to a specific set of internal rules about force production, bony attachments, and how the body moves. So how accurate are the anatomy trained lines? There was a systematic review created by Wilk, and what he looked at was independent evidence based on 6 of the 13 lines. So he looked at all of the research and looked at ones that had the strongest evidence. What he found was that the research was strongest for the reality of the superficial back line, the back functional line, and the front functional line. So there was lots of strong evidence of research based on the reality of those lines. But what he did find was that there was little evidence of the reality of the lateral line, the spiral line, and the superficial front line. And during this time, there was a shift in anatomy trains and what Thomas Myers was thinking and believing about anatomy and anatomy trains, as some of the lines that were deemed to be unreal and not connected based on the rules that he applied initially. So what does this mean globally? Well, if you dissected any parts of the body, chances are you are going to be able to find lines, patterns, and connections because everything is connected, because fascia is everywhere. And it just demonstrates that everything is all connected. So some of the anatomy trained lines may not be completely accurate, as we know more now than we did when Thomas Myers created the initial lines. But what was really important, what Thomas Myers did really well, was think globally and how the body is all connected. And that is really key when we're working with our clients within sports massage. And looking at everything together. So let's take the principles of Wolff's Law and the effect it has on bones and potentially collagen and the whole body, looking at the anatomy trains now as we know it. One part of our body can be affected by what's happening in another part of the body, as we had the example of pushing your foot down into the ground. So we can start thinking about your client as a whole structure and as a whole person, rather than just an individual body part. And their movement patterns over their day, over their week, in their life can have an impact on those anatomy trained lines and also the whole body. So they're doing the same movement over and over and over again. As an example, staying still, doing lots of desk work over time, then that fascial system has the ability to change. There may be increased fibroblast activity in the front of the muscles, and there's a big stretch happening in the posterior part of the back muscles. So we know that movement is really important for this, and getting our clients moving as well as possible can help the fibroblasts move in different directions, increase that force production throughout the whole body. And as a final summary, fascia is abundant with sensory receptors, and we can affect them within our massage skills by applying touch and pressure onto the skin. Fascia is made of extracellular matrix, collagen, and fibroblasts, and fibroblasts synthesize collagen where there is tension and mechanical force to maintain balance. And the human body is a huge tensile structure, and the relationship between the bones and the myofascial system is key. So we want to think about whole body movements alongside our massage skills to help improve tension, mechanical force, to create balance within the body and balance between the bones and the myofascial system.